For so many of us, sex trafficking can sound like it's something we're far removed from, like it could never happen to us or the people we're around. But UNICEF says it's the second largest criminal industry in the world, and anyone, regardless of class, gender, age, or education level, can be trafficked.
I felt trapped. I felt like, how am I going to get out of this? And you didn't know if you were going to live or die.
Loyola University analyzed the impact trafficking has on its victims in 2014. One woman anonymously told her story of being forced to have sex with 10 to 20 men a day, doing what a strange man told her out of fear of collecting more scars across her body. This is the experience of just one person who could have benefited from getting help sooner.
This isn't just a problem in our own backyard or anywhere else. It's a global issue, so it's something that really needs to be tackled.
Michael Recupero is Director of Patient Care Services for Northwell Health in New York. The health system has created an initiative to identify and help trafficking victims in their care.
And we know that identification is the hardest thing. And since you have so many of these people that are in trafficking situations accessing healthcare, it only made sense to partner with healthcare, get us involved, and make sure that we can identify these people and then get them the right resources.
Loyola's study includes responses from 106 victims of trafficking. Most of them reported receiving medical treatment while in captivity, and by far the most consistent way was in an emergency room.
So it's a very delicate situation. You just don't want to throw up red flags and get them in trouble, so to speak, or have some harm come to them as a result of this. So you really need to gingerly give them the resources and provide them. It may not even happen on the first attempt.
Many of the victims surveyed said doctors recognized they lived a life, quote, on the street, but didn't catch the full picture. Some said they didn't believe the medical staff caught on to their situation at all. Loyola's analysis says right now our healthcare system is failing trafficked women and children, and law, policy, and protocols have to change to fix the problem.
It is, how do I recognize the red flags to even find if somebody is in that situation? Because if somebody is being trafficked, when they come here, they don't say that, they don't scream it out, they're not putting it out there. They try to get by without even being noticed, even though they want the help.
Northwell Health's initiative will happen in phases, educating staff members on trafficking and eventually creating a task force to assist with a potential victim they've identified.
If we help one person get out of their trafficking situation, then we've accomplished everything we've expected.
UNICEF says trafficking has been reported in all 50 states. Dr. Recupero says the plan Northwell is following could easily be implemented in any other health system. In fact, countless victims are counting on them to do just that.